Welcome back to another episode of the Tommy Brideson Show. Today, I'm going to be talking about why I think restoring range of movement after you've had or sustained an injury is sometimes the quickest way out of that injury. Now, I'm going to start this off by saying there is nothing more frustrating than being put out of training by a simple thing such as an injury. Your mind is saying, hey, I want to train, but your body is saying, mate, I'm giving you a warning sign. You need to slow down or change your particular pattern. Otherwise, you're going to end up in a state of injury. Now, in saying that, you can also have acute injuries, which can put you back. But what I'm really talking to today is more so mechanical tension and pain that you develop through training or just through life and situations that occur. Now, when we live in these sensitized states, our body is really good at adapting. It's really good at creating compensation strategies, which is going to allow you to continue to do the thing that you want to do, but it comes at a cost. Now, if the compensation strategy over time becomes super, super dominant, what ends up happening is you develop pain. Now, the pain isn't actually necessarily pain. It's an oversensitized state in your body that then gives you warning signals, and there's like a relay loop back to the brain. So what I sort of want to look at today is, sometimes when you are in these states, everything that you do is painful. Every test that we could possibly test for is going to show to be positive, which is going to show a false positive. And it's going to show that basically every structure, let's use an example of the shoulder. Say you have pain going into an overhead pressing position and you come in and you've lived in this sort of, oversensitized state for say, the last, 6 to 8 weeks, and you've kind of, pushed off getting treatment, pushed off getting anything done to your actual shoulder to help it. And then you're like, all right, I need to get some treatment. Now you get into treatment, every test that I or another practitioner would do on you would potentially provoke pain. So it's going to show up that, you might have a labral issue, you could have a bicep issue, you could have, a rotator cuff issue. But the reality is you're just in an oversensitized state. Now, I don't want to downplay, the validity and, the importance of testing and stuff. But when you are in these really mechanical states and everything is just really switched on and hyperactive, sometimes the easiest pathway out of it is just restoring some normal range of movement and function. Now, when we're actually looking at normal range of movement, so let's just take the shoulder and moving into an overhead position, for instance, as I take my arm up into that overhead position, there's a combination of movements which allow me to actually get into that overhead position. So it's not just a singular movement. Now, as I'm taking my arm up into that overhead position, I'm taking my arm into shoulder flexion. So I'm going to need my extensors to allow that length. So we're starting to look at lats, teres major. As we start to get into an overhead position, our shoulder blade starts to rotate up and tilt backwards. So then I'm going to need that movement and motility through the actual shoulder blade itself to allow me to continue to move up into an overhead position. But then to actually get up into that fully flexed position in an overhead position, I'm going to need to have some external rotation of my actual arm itself. So you can see that, in a really sensitized mechanical state, I might only be able to lift my arm up to shoulder height because I'm limited by pain. So even testing in an overhead position is going to be impossible. So I'm not really going to be able to test all structures anyway. So sometimes just the path of least resistance is going, okay, well, we are really limited in range of movement into that particular range. Let's just say shoulder flexion into an overhead position. How do we restore that? How do we restore normal function, normal range of movement to essentially allow the structures or the tissue or whatever is damaged or whatever is oversensitized to settle down a little bit. Now, you can obviously use, different treatment modalities. You can use needling, you can use manual therapy, you could use cupping, you could use, exercise and trigger pointing. But the reality is what we want to do is try and get that shoulder into a state where it's a little bit less sensitive so that then we can move it into full ranges. And then later on down the track, once it starts to settle down a little bit, we can then start to go, okay, what do we actually think the real cause of the injury is? Because sometimes we, even as practitioners, it's confirmation bias 101. You get someone coming in and you want to give a diagnosis. Now, in terms of diagnosis, like, even the way that they teach it at uni is kind of, you come up with like one of three potential pathways out of it. And you go, okay, it could be X, it could be Y, it could be Z. But the reality is, when you're in one of these really sensitive, sensitized and acute or chronic phases, everything's going to show up as positive. So restoring your normal range of movement, restoring that particular function is just going to allow you to get a better lens on what's actually happening. Now, I often say that, when we're getting pain, especially, most lifters in the gym, we get pain and it doesn't happen overnight. It generally builds up over a particular period of time. So, you might be, doing an overhead press movement, for instance, and it feels a little bit sore through your shoulder, but you can get on with it. Another 2, 3, 4 weeks goes on, and then all of a sudden you have a bit more of a serious pain in the shoulder. Your sleep might be affected. And you're like, all right, I need to look into this. When you're in those particular stages of training, it's really mechanical in nature. So there's something going on that's either technical in terms of like how you're actually doing the movement, or there's a potential block in the range of movement, or something's not functioning. Like as you get into that overhead shoulder position, your shoulder blade might not be moving. It might be completely locked down, or you might not have, enough extensibility through your lat to get you into that overhead position. So what you actually end up happening there is you get an injury as such, but the injury as such is more so a fact because you didn't actually have the range of movement to start with, or you didn't have the ability to execute the particular movement to start with. So then if we go back to sort of what I said at the start, I'm like, well, you're kind of hitting things both ways. If you restore normal range of movement and function where possible, a lot of the time it also helps to actually offset the pain that you're sort of dealing with, and it actually deloads the structures itself and allows, a lot of the inflammation to drop off, a lot of the sensitivity to drop off. And then at that point, once you start to get a better feel for what actually is happening at the area that's injured, then you can start to go, okay, let's figure out a more long-term viable plan out of this. Now, that plan might look like, we need specific mobility stuff to ensure that you have that full range of movement. We might need to add in some exercises to bring up strength or stability in certain areas. We might need to bring awareness and attention to, say, the shoulder blade. If we're talking about the shoulder, there might be poor scapular mechanics that's leading to just these patterns that aren't overly effective for sort of, holding load and doing multiple reps. So that at that point is when we actually start to put more of a prehab plan in place, where we go, okay, let's hit this from a few different angles. Let's make sure we have the range of movement. Let's make sure we can continue to stabilize, perform, and function. And then what that's going to do is long-term, hopefully it's going to keep you more so out of this oversensitized mechanical pain state. And that's really what we want to get to with training and with these rehabs. So, I think, quite often, when you get someone coming in as a physio myself, first session is, a lot of the time it's a symptom management. You're obviously trying to figure out a plan of attack from word go, and sometimes it is a very easy fix, but other times you're essentially using the session to try and downregulate the tissue structures, to improve on range of movement, to improve on function, so that then second session, third session, you can really start to make some improvements and put a better plan in place. And that's it for today's episode. I'll see you guys next time.